Informed consent. In informed consent, the guiding principle for researchers is that a person's decision to participate in research is to be voluntary and based on sufficient information and adequate understanding of both the proposed research and the implications of participation in it. From Chapter 2.2 on the National Statement on Ethical Conduct of Human Research. Freely given informed consent must be obtained from every subject prior to research participation in accordance with national cultures and requirements. When a subject is not capable of giving informed consent, the permission of a legally authorised representative should be obtained in accordance with applicable laws. What is meant by informed consent? Informed consent is a decision to participate in research taken by a competent individual who has received the necessary information, who has adequately understood the information, and who, after considering the information, has arrived at a decision without having been subjected to coercion, undue influence, inducement, or intimidation. What is meant by freely given consent or voluntary participation? And how is this implemented within GCP? What is meant by in accordance with national cultures and requirements? In some cultures, an investigator may enter a community to conduct research or approach subjects for their individual consent only after obtaining permission from a community leader, a council of elders, or other designated authority. Such customs must be respected. In no case, however, may the permission of a community leader or other authority substitute for individual informed consent. Who may administer informed consent? The person who conducts the consent interview should be knowledgeable about the study and able to answer questions. Some sponsors and ethics committees require the clinical investigator to personally conduct the consent interview. If it's someone other than the clinical investigator conducting the interview and obtaining consent, the investigator should ensure that this responsibility is formally delegated to that individual, and that the person so delegated is qualified and receives appropriate training to perform this activity. What information should be given to study subjects in accordance with GCP? Certain essential elements of informed consent should be included in the informed consent discussion, the written informed consent form, and any other information to be provided to subjects who participate in the study. All information must be communicated in a comprehensive and understandable manner. This includes, but is not limited to, the title of the protocol, the identity of the sponsor, the identity of the clinical or principal investigator and their institutional affiliation, and the source of research funding. That the subject's participation in the trial is voluntary, and that the subject may refuse to participate or withdraw from the trial at any time, without penalty or loss of benefits to which the subject is otherwise entitled. The purpose of the trial treatment and the probability of random assignment to each treatment. The trial procedures to be followed, including all invasive procedures, and the reasonably foreseeable risks or inconveniences to the subject, as well as the reasonably expected benefits. When there is no intended clinical benefit to the subject should be made aware of this. The alternative procedure or course of treatment that may be available to the subject, and the compensation or treatment available in the event of trial-related injury, and the anticipated money or other forms of payment, if any, to the subject for participation in the trial. Confirmation that the subject records identifying them will be kept confidential. Who to contact for further information throughout the progress of the trial, and the expected duration of the subject's participation in the trial. What is meant by comprehension? That is, how do investigators ensure that subjects understand information about the study, and how is this implemented in accordance with GCP? The investigator must convey the information, whether orally or in writing, in language that suits the individual's level of understanding. The investigator must bear in mind that the prospective subject's ability to understand the information necessary to give informed consent depends on that individual's maturity, intelligence, education, and belief system. What is meant by vulnerable persons? Examples of vulnerable persons include, but are not limited to, children, individuals with diminished mental capacity, prisoners, institutionalized persons, including orphans, patients in emergency situations, the economically disadvantaged, and individuals who cannot give consent. How is informed consent documented? Is getting the subject to sign a consent document all that is necessary? And should the process be documented throughout the study? The subject should sign a consent form, or in the case of incompetence, a legal guardian or other duly authorised representative should do so, and the subject must receive a signed copy of that consent and patient information sheet. When is informed consent obtained? And what is meant by prior to trial participation? Informed consent must be obtained from each subject or the legally authorised representative prior to involving the subject in any study-specific activities or procedures, particularly any invasive procedures.